If you've been told that your symptoms are normal, or you've spent years trying to understand why your body feels off, with irregular periods, weight changes that you can't explain, skin changes, and fatigue, PCOS is a condition worth understanding. It's one of the most common and underdiagnosed hormonal issues that women experience. The good news is that it is manageable, and I'm going to explain what it is and how to manage it. PCOS stands for Polycystic Ovarian Syndrome, and it's a condition where the ovaries produce higher than normal levels of androgens. Androgens are typically known as male sex hormones, but it's important to know that all genders, both male and female, make androgens, but in females, it's generally in lower levels than is exhibited in PCOS. This offset of hormones can often produce weight gain, fatigue, changes in the skin. It can result in irregular periods as well. It can also change your mood, and sometimes all of these symptoms occur at once, which can feel overwhelming, but it is manageable. PCOS affects roughly 6 to 12% of women in the United States, and it often runs in families, so it can have a genetic component, and it often starts to have symptoms between the first period and somewhere between the 20s and 30s. Common symptoms include irregular periods, so you might notice that you've gone more than 3 months without one, or you experience less than 9 cycles per year. It's also associated with the presence of ovaries on the cysts, which are found during ultrasound. It can be associated with fertility issues and pelvic pain. PCOS is also linked to insulin resistance, type 2 diabetes, thyroid dysfunction, and in some cases, endometrial cancer if you go for long periods of time without having a menstrual cycle. And that's not to scare you, it's just to let you know that diagnosis matters and getting treatment and managing it matters, because there's a lot that you can do to help manage this and overcome it. There's a lot of lifestyle and nutritional changes that make a meaningful impact in managing PCOS. Limiting sugar and refined carbohydrates, so keeping it to a minimum with the pasta, rice, bread, and sugars, because those drive a lot of the symptoms of PCOS. Getting 30 to 45 minutes of daily physical activity. That's going to help with the insulin resistance and weight gain that's associated with PCOS. And then additionally, supplementation with Myo and D-Chiro Inositol. There's a lot of research behind the 40-to-1 ratio of Myo and D-Chiro Inositol and supplementation and helping manage a lot of the symptoms of PCOS. Intimate Rose's Myo and D-Chiro Inositol with ashwagandha and vitamin D is specifically formulated to support hormone level, support mood with the ashwagandha, and to provide enhanced energy with the vitamin D. It's backed by science to help improve the symptoms of PCOS. I'll link the supplement below here, and as always, if you have any questions or comments, please don't hesitate to leave them below and we'll get them answered for you.